Marcus Chen pushed his cleaning cart down the sterile hallway of Metro General Hospital, the familiar squeak of the left wheel echoing against the polished floors. At 38, he moved with the quiet efficiency of someone who had learned to navigate these corridors without drawing attention. His navy blue janitor's uniform was crisp and clean, pressed with the same care he once applied to his surgical scrubs years ago. The night shift at Metro General was his domain. From 11 p.m. to 7 a.m., Marcus cleaned every room, every hallway, every corner of the cardiac wing. He knew which nurses preferred their coffee station spotless before their breaks, which doctors left their offices in chaos after particularly difficult cases, and which patients couldn't sleep and might appreciate a gentle conversation with the man who emptied their trash. Tonight, like every night for the past 3 years, Marcus began his rounds in the cardiac intensive care unit. The soft beeping of monitors created a symphony he understood better than most. His trained ear could distinguish between the steady rhythm of a healing heart and the irregular patterns that meant trouble. But Marcus Chen wasn't supposed to know these things. He was just the janitor. Room 314 held Mrs. Patterson, a 72-year-old woman recovering from triple bypass surgery. As Marcus quietly emptied her wastebasket, he noticed her oxygen saturation monitor showing slightly lower numbers than optimal. Her breathing seemed labored, and her color wasn't quite right. Any cardiac surgeon would recognize the signs of fluid retention building in her lungs. Marcus paused, his hand gripping the edge of the trash bin, fighting the urge to check her chart or call for a nurse. Instead, he continued his cleaning, but made sure to work more slowly than usual, keeping an eye on Mrs. Patterson's monitors. 20 minutes later, her call light came on, and Nurse Jennifer Rodriguez hurried in to find the patient complaining of difficulty breathing. Marcus watched from the corner of his eye as Jennifer made the same assessment he had made earlier, quickly calling for the attending physician. Dr. Sarah Williams arrived within minutes, her stethoscope already in hand. Marcus had observed her for months, noting her competence and dedication to her patients. She was thorough, compassionate, and reminded him of the doctor he used to be. As she listened to Mrs. Patterson's lungs and ordered a chest X-ray, Marcus felt the familiar ache of watching medicine being practiced while he remained on the sidelines. He finished cleaning the room and moved to the next, but his mind stayed with Mrs. Patterson. The fluid buildup was early stage, easily treatable with the right diuretics and careful monitoring. He had seen thousands of similar cases during his years as a cardiac surgeon at Johns Hopkins, before everything changed, before his life took a turn he never could have imagined. The photograph in his wallet showed why he was here, why he had chosen this life of invisibility. Lily Chen, 8 years old, with her mother's delicate features and her father's determined spirit. She was sleeping peacefully in their small apartment 12 blocks away, trusting that her daddy would come home safely from his night job at the hospital. She didn't know that her father had once been Dr. Marcus Chen, one of the most promising cardiac surgeons on the East Coast. She only knew that he worked hard to take care of her, and that was enough. Marcus continued his rounds, moving through the coronary care unit with practiced efficiency. He restocked supplies, sanitized surfaces, and maintained the sterile environment that was crucial for patient recovery. Every task was performed with the same attention to detail he once brought to surgical procedures. The other hospital staff saw a dedicated janitor who took pride in his work. They didn't see the man who could read an EKG faster than most residents, who could identify heart murmurs by sound alone, who dreamed about surgery every night and woke up reaching for gloves he no longer had the right to wear. Where in the world are you watching from as you hear Marcus's story? What time is it where you are? Whether you're starting your day or ending it, Marcus's journey is just beginning, and like him, sometimes we all have to hide our true selves to protect the ones we love. The elevator doors opened on the 4th floor, and Marcus guided his cart toward the general medical units. Here, the pace was different, less intense than the cardiac wing, but no less important. He cleaned each room methodically, observing details that others might miss. In room 428, an elderly man was having trouble with his 4-line. The insertion site was slightly swollen, and Marcus could see that the catheter had probably shifted, causing infiltration of fluid into the surrounding tissue. The patient, Mr. Rodriguez, was pressing his call button repeatedly, clearly in discomfort. Marcus wanted to help, wanted to explain that the 4 needed to be repositioned, but he couldn't. He wasn't supposed to know these things. Instead, he worked quietly, hoping a nurse would respond quickly to the call. Nurse Kevin Thompson arrived 15 minutes later, looking harried from a busy night. He was a good nurse, but relatively new to the unit, and Marcus could see him struggling to assess the 4 situation. Kevin tried to adjust the line, but his technique was causing more discomfort to the patient. Marcus gripped his mop handle tighter, fighting every instinct to step forward and help. Finally, Kevin made the decision to remove the 4 and start a new line. Marcus watched as the young nurse struggled with the insertion, missing the vein twice before finally achieving success. The whole process took 20 minutes and left Mr. Rodriguez exhausted and uncomfortable. Marcus could have done it in 30 seconds, with minimal discomfort to the patient, but his hands remained on the mop handle. This was his reality now. Watching medical situations he could easily handle, staying silent when his expertise could help, being invisible when visibility had once been his greatest strength. The malpractice lawsuit that had destroyed his career might have been overturned on appeal, but the damage to his reputation and the media attention had been devastating. When photographers started following Lily to school, when reporters camped outside their home, Marcus knew he had to disappear from the medical world to protect his daughter. He finished cleaning the 4th floor and moved to the surgical wing, where tomorrow's procedures would begin in just a few hours. The operating rooms were pristine, waiting for the skilled hands that would save lives, repair hearts, and give patients second chances. Marcus had once been those hands. Now he was the man who made sure the environment was perfect for others to perform miracles. In OR3, he paused at the heart-lung machine, the same model he had used hundreds of times during cardiac procedures. His fingers itched to touch the controls, to remember the feeling of holding a human heart in his hands, of being the difference between life and death. But those days were gone, buried under legal documents and media scandal, sacrificed for his daughter's chance at a normal life. The night continued its familiar rhythm. Marcus cleaned, observed, and remembered. He was a ghost in the hospital where he had once been a hero, invisible to those who might have once sought his opinion on complex cases. But he was still here, still close to the medicine he loved, still finding ways to serve even if no one knew the true extent of his capabilities. As dawn approached, Marcus returned to the cardiac wing to complete his final rounds. Mrs. Patterson was sleeping peacefully, her breathing much improved after the treatment Dr. Williams had prescribed. The sight brought a small smile to Marcus's face. Medicine was still happening, lives were still being saved, and in his small way, he was still part of it all. He stored his cleaning supplies and prepared to head home to Lily, who would be waking up soon for school. She would ask about his night, and he would tell her about the patients who were getting better, the nurses who worked so hard, and the doctors who never gave up. He wouldn't tell her about the procedures he could have performed, the diagnoses he could have made, or the skills that lay dormant in his careful hands. But as Marcus walked toward the hospital exit, he didn't know that tonight would be different. He didn't know that within hours, his carefully constructed invisible life would be shattered by a moment of crisis that would force him to choose between his daughter's safety and a stranger's life. He didn't know that his perfect 4 skills were about to be noticed, or that a stopped heart would soon restart not just a patient's life, but his own journey back to the light. 3 weeks passed in the familiar rhythm of night shifts and hidden expertise. Marcus had settled into his routine of invisible observation, watching the medical staff work while keeping his own knowledge carefully concealed. But tonight felt different from the moment he arrived at Metro General. The emergency department was unusually busy for a Tuesday evening. Marcus could hear the elevated voices of the trauma team, the rapid footsteps of nurses rushing between rooms, and the constant chiming of monitors demanding attention. As he began his cleaning rounds, he noticed Dr. Williams looked more stressed than usual, her usually calm demeanor strained by the influx of patients. In the cardiac unit, Marcus encountered a situation that made his hands tremble as he gripped his mop handle. Room 318 held a 45-year-old construction worker named David Martinez, who had been admitted earlier that day with chest pain. The man's wife sat beside his bed, holding his hand while their teenage son slept in the uncomfortable visitor's chair. Marcus could see immediately that Mr. Martinez was in distress. His skin had a grayish pallor, and sweat beaded on his forehead despite the cool temperature of the room. The cardiac monitor showed subtle changes that would be easy to miss unless you knew exactly what to look for. Marcus knew. The ST segments were beginning to elevate, indicating that Mr. Martinez was having a heart attack right now, at this very moment. The patient's call light had been on for several minutes, but the nursing staff was overwhelmed with the emergency department crisis. Marcus stood frozen, watching a man slip deeper into cardiac distress while his family slept beside him, unaware that their husband and father was dying. Every fiber of his being screamed to take action, to call for help, to do something other than stand there with a mop in his hands. Finally, Marcus made a decision that would haunt him for weeks. He quietly left the room and found Nurse Rodriguez at the nurse's station, buried in paperwork and trying to manage multiple patient requests simultaneously. Marcus approached her carefully, knowing he had to be subtle about his concern. "Excuse me, Jennifer," he said softly. "I was cleaning room 318, and Mr. Martinez seemed to be having some discomfort. His wife mentioned he was asking for a nurse about 10 minutes ago." Jennifer looked up from her charts, exhaustion evident in her eyes. She glanced at the clock and realized how long the call light had been on. "Thanks, Marcus. I'll check on him right away." Marcus returned to his cleaning cart, but positioned himself where he could observe room 318. Within minutes, he heard Jennifer's urgent voice calling for Dr. Williams. The cardiac team responded quickly, and Marcus watched through the doorway as they worked to stabilize Mr. Martinez. The man would survive, but Marcus knew the delay had cost precious heart muscle that could never be recovered. As the crisis in room 318 continued, Marcus moved to the next floor, his mind churning with frustration and guilt. He had been trained to save lives, to act decisively in moments of crisis. Instead, he had been reduced to quietly suggesting that a nurse might want to check on a patient. The compromise felt like a betrayal of everything he had once sworn to uphold. The surgical wing was quiet at this hour, the operating rooms dark and waiting for tomorrow's procedures. Marcus found himself in OR3 again, staring at the equipment he once knew how to operate better than his own heartbeat. In the dim light, he could almost see himself as he used to be, gowned and gloved, holding instruments with the confidence of someone who had trained for years to save lives. His reflection in the stainless steel surfaces showed a different man now. The janitor's uniform, the cleaning supplies, the careful posture of someone who had learned to be invisible. But his hands were the same hands that had once performed miracles. His mind held the same knowledge that had once made him one of the most sought-after cardiac surgeons in the country. Marcus thought about Lily, safe in her bed at home, unaware of the internal battle her father fought every night. She was thriving in school, making friends, living the normal childhood he had sacrificed his career to provide. When other parents asked what her daddy did for work, she proudly told them he helped sick people get better at the hospital. She wasn't wrong, but she also didn't know the full truth of what he was capable of. The rest of the night passed more quietly, but Marcus couldn't shake the image of Mr. Martinez's family, the fear in his wife's eyes when she realized something was wrong, the way their son had woken up to find his father surrounded by medical equipment. These were the moments that reminded Marcus why he had become a doctor in the first place, and why watching from the sidelines felt like a special kind of torment. As his shift ended, Marcus completed his final rounds with the same meticulous attention to detail he brought to every task. He restocked supplies, sanitized surfaces, and ensured that the cardiac wing was ready for the day's shift. Dr. Williams passed him in the hallway, offering a tired smile and a brief thank you for his hard work. She had no idea that the man pushing the cleaning cart had diagnosed Mr. Martinez's heart attack before she had even been called to the room. She didn't know that Marcus had watched her work with the same professional admiration he once reserved for his most respected colleagues. To her, he was simply the dedicated night janitor who took pride in keeping the hospital clean and safe. Marcus walked home through the quiet streets, his mind already shifting to his other role as a single father. In a few hours, he would wake Lily for school, help her with breakfast, and listen to her excited chatter about her upcoming science project. He would be fully present for her, pushing aside the weight of his hidden identity to focus on being the parent she needed. But tonight had been different. Tonight, he had been forced to find a way to help without revealing himself, walking a dangerous line between his old life and his new one. As he climbed the stairs to their apartment, Marcus wondered how long he could maintain this delicate balance, and what would happen when the moment came that he couldn't stay silent anymore. The following week brought an unexpected change to Marcus's carefully structured world. Hospital administration had decided to implement a new policy requiring all night shift workers to complete basic first aid certification. Marcus sat in the small conference room with 12 other maintenance and support staff members, watching the instructor demonstrate CPR techniques on a practice dummy. For everyone else in the room, this was new information. They leaned forward, taking notes as the instructor explained chest compression depth and rhythm. Marcus sat quietly in the back, fighting the urge to correct the instructor's slightly outdated technique. The current guidelines had changed 2 years ago, reducing the compression rate from 100 per minute to between 100 and 120. But pointing that out would raise questions he couldn't answer. When it came time for Hansen practice, Marcus found himself paired with Elena Vasquez, a housekeeper who had worked at Metro General for 15 years. Elena struggled with the chest compressions, her technique inconsistent and her confidence low. Marcus watched her fumble with the dummy, wanting desperately to help but knowing he had to be careful about how much knowledge he revealed. "Like this, Elena," he said gently, positioning his hands on the dummy's chest. "You want to keep your arms straight and use your whole body weight. The compressions should be steady and deep." Elena watched as Marcus demonstrated the technique with unconscious precision. His hand placement was perfect, his compressions exactly the right depth and rhythm, his movements economical and professional. The instructor noticed and approached their station. "Very good, Marcus," the instructor said, observing his technique. "Have you had medical training before?" Marcus felt his heart rate spike, but kept his expression neutral. "Just what I picked up from watching the staff here," he replied. "After 3 years of night shifts, you see a lot." The instructor nodded, satisfied with the explanation, and moved on to help another pair. But Marcus noticed Elena looking at him with curiosity. His demonstration had been too perfect, too professional. He had revealed more than he intended, and now he would have to be even more careful. During the break, Elena approached him with a cup of coffee and a thoughtful expression. "You know, Marcus," she said, settling into the chair beside him. "I've been working here a long time, and I've seen a lot of people come and go. Some folks, they just have a way about them when it comes to medical stuff. Natural instinct, you know." Marcus sipped his coffee, choosing his words carefully. "I just pay attention, Elena. It's important to understand what's happening around us, especially at night when there's fewer people around." Elena studied his face for a moment, then nodded slowly. "My cousin, he's a paramedic down in San Diego. He always says the best medical people are the ones who watch and learn, who care about getting things right. Says it's more than just training, it's about having the right heart for it." The conversation moved on to other topics, but Marcus could feel Elena's increased attention to his actions throughout the rest of the training session. When they practiced taking vital signs, his technique was flawless. When they discussed recognizing medical emergencies, his questions were too sophisticated for someone who had supposedly learned everything from casual observation. Later that night, during his regular rounds, Marcus found himself being more careful than ever about concealing his knowledge. In the cardiac unit, he encountered a situation that tested his resolve more than any before. Room 322 held a 60-year-old woman named Margaret Foster, who had been admitted for a routine cardiac catheterization procedure scheduled for the morning. Mrs. Foster was awake and clearly anxious about her upcoming procedure. Her daughter sat beside her, trying to provide comfort but obviously worried herself. As Marcus quietly cleaned the room, he overheard their conversation about the risks of the procedure, their fears about complications, and their confusion about some of the medical terminology the doctors had used. The daughter was asking questions that Marcus could have answered easily, providing reassurance about a procedure he had performed hundreds of times. The catheterization Mrs. Foster was scheduled for was one of the safest cardiac procedures available, with minimal risk and excellent outcomes. But Marcus had to stand silent, listening to their unnecessary anxiety while he emptied trash cans and wiped down surfaces. Mrs. Foster noticed him working and smiled kindly. "You're here every night, aren't you?" she asked. "I've seen you in the hallway. You do such a thorough job keeping everything clean." "Thank you, ma'am," Marcus replied. "I hope your procedure goes well tomorrow." The daughter looked up hopefully. "Have you seen many people have this test done?" she asked. The doctors explained it, but it's still scary, you know? Marcus felt the familiar weight of his concealed knowledge. He wanted to tell them about the thousands of successful catheterizations he had either performed or supervised, about the minimal risks and excellent outcomes, about how skilled Dr. Williams was at performing these procedures. Instead, he chose his words carefully. "I've seen many patients come through here for various procedures," he said. "The cardiac team here is very skilled, and they take excellent care of their patients. Dr. Williams is particularly thorough and careful." Mrs. Foster's daughter smiled gratefully. "That's reassuring to hear. Sometimes it helps to get perspective from someone who sees it all." Marcus finished his cleaning and moved on, but their conversation stayed with him. He was walking a tightrope between helping and hiding, between using his knowledge and protecting his secret. Every interaction risked exposure, but staying completely silent felt like abandoning the people he had sworn to serve. The rest of the night passed quietly, but Marcus couldn't shake the feeling that his carefully constructed invisible life was beginning to crack. Elena's thoughtful questions during the training session, Mrs. Foster's daughter's gratitude for his reassurance, the instructor's notice of his perfect technique, all these moments were small fractures in the wall he had built around his true identity. As dawn approached, Marcus completed his final rounds with the same meticulous care he brought to every task. But tonight had been different. Tonight, he had been forced to reveal small pieces of his knowledge, to help in ways that walked dangerously close to the line he had drawn for himself. Walking home through the quiet streets, Marcus realized that his secret was becoming harder to maintain. The medical knowledge he possessed wasn't something he could simply turn off or ignore. It was part of who he was, woven into his instincts and reactions. Hiding it completely was becoming not just difficult, but nearly impossible. At home, Lily was still sleeping peacefully in her bed, unaware of her father's internal struggle. Marcus looked at her peaceful face and reminded himself why he had made these sacrifices. Her safety, her normal childhood, her chance to grow up without the shadow of his past, these were worth any personal cost. But as he prepared for bed, Marcus couldn't shake the feeling that change was coming, whether he was ready for it or not. 2 nights after the first aid training, Marcus arrived at Metro General to find the hospital in controlled chaos. A multi-car accident on the interstate had flooded the emergency department with trauma patients, and the ripple effects were being felt throughout the entire facility. The cardiac unit was being prepared to receive overflow patients, and the nursing staff was stretched thinner than Marcus had ever seen. Dr. Williams rushed past him in the hallway, her usually composed demeanor replaced by the focused intensity of someone managing multiple critical cases. Nurses moved with urgent purpose, their conversations clipped and professional as they coordinated care for the influx of patients. Marcus began his cleaning rounds, but quickly realized this would be unlike any night he had experienced since starting at Metro General. In room 315, a new patient had just been brought up from the emergency department. Thomas Brennan, a 32-year-old paramedic who had been off duty when the accident occurred, had stopped to help at the scene and been struck by debris from one of the vehicles. The irony wasn't lost on Marcus that a man who spent his life saving others was now lying in a hospital bed, his own life hanging in the balance. Brennan was conscious but clearly in significant pain. His left arm was in a temporary splint, and Marcus could see from the positioning that it was likely a complex fracture. More concerning was the man's breathing pattern and the subtle signs of internal bleeding that Marcus recognized from his trauma surgery days. The patient needed immediate attention, but the nursing staff was overwhelmed with other critical cases. Marcus cleaned the room methodically, listening to Brennan's labored breathing and watching his vital signs on the monitor. The man's blood pressure was dropping slowly but steadily, and his heart rate was climbing. These were classic signs of internal bleeding, possibly from a ruptured spleen or liver laceration. Marcus had seen it countless times during his residency in trauma surgery. Brennan looked at Marcus with the trained eye of someone who worked in emergency medicine. "You're the night janitor, right?" he asked, his voice strained. "I've seen you around when I've brought patients in." "That's right," Marcus replied, continuing his cleaning while keeping a careful eye on the monitors. "How are you feeling?" "Like I got hit by a truck," Brennan said with a weak smile. "But I've been watching my numbers, and they're not looking great. My pressure's dropping, and I can feel my heart racing." Marcus paused in his work, fighting the urge to provide the medical assessment that was screaming in his head. The man was right to be concerned. His condition was deteriorating, and he needed immediate surgical intervention. But Marcus couldn't say that. He wasn't supposed to know that. Instead, Marcus moved closer to the bed, speaking quietly. "I think your nurse might want to check on you soon. Maybe I should mention to her that you're having some concerns about how you're feeling." Brennan studied Marcus's face intently. "You know, for a janitor, you seem to understand what's happening here better than most. That's good situational awareness." Before Marcus could respond, Nurse Rodriguez entered the room, looking frazzled but determined. She quickly assessed Brennan's condition, her expression growing concerned as she noted the same vital sign changes that Marcus had observed. Within minutes, she was calling for Dr. Williams, and Brennan was being prepped for emergency surgery. As the medical team worked to stabilize Brennan for transport to the operating room, Marcus stepped back into the hallway. But he couldn't resist watching through the doorway as they prepared the patient. Dr. Williams was ordering the right tests, making the correct decisions, but Marcus could see she was operating under tremendous pressure with limited time. Elena Vasquez appeared beside him, her cleaning cart parked nearby. She had been watching him watch the medical team, and her expression was thoughtful. "You really care about the patients, don't you, Marcus?" she said quietly. "We all do," Marcus replied, but he knew his answer sounded inadequate. "Some more than others," Elena observed. "I've been working here 15 years, and I've seen a lot of support staff come and go. Most of them do their jobs well, but they don't watch the medical stuff the way you do. They don't understand what they're seeing." Marcus felt exposed under her scrutiny. "I just want to do my job well, Elena. Part of that means understanding the environment we work in." Elena nodded slowly, but Marcus could see she wasn't entirely convinced. She knew there was more to his story, but she was too respectful to push harder. Still, her attention was becoming another source of stress in Marcus's already complicated existence. The rest of the night continued at a frantic pace. Marcus moved through his rounds, cleaning and restocking while the medical staff worked to manage the overflow from the accident. He witnessed several situations where his expertise could have been valuable, where his training might have made a difference in patient care. But he remained silent, invisible, watching skilled professionals handle cases he had once been trained to manage. In the early morning hours, as the crisis began to subside, Marcus found himself in the family waiting area. Several families were gathered there, waiting for news about their loved ones from the accident. Among them was a woman in her 60s, clearly the mother of one of the patients. She was crying quietly, overwhelmed by the uncertainty and fear. Marcus emptied the trash containers in the waiting area, moving quietly to avoid disturbing the families. But the woman noticed him and looked up with tear-filled eyes. "Excuse me," she said. "Do you work here? Do you know anything about what's happening?" Marcus knelt down beside her chair, setting aside his cleaning supplies. "I work the night shift," he said gently. "I know the medical staff here is excellent, and they're doing everything they can for everyone who was brought in tonight." The woman gripped his hand unexpectedly. "My son was in the accident. He's a paramedic, and he was trying to help when he got hurt. The doctors haven't told us much, just that he needed surgery." Marcus realized she was talking about Thomas Brennan, the patient he had helped earlier. "Your son is in very capable hands," he said. "Dr. Williams is an excellent surgeon, and the entire team here is dedicated to giving him the best possible care." Something in Marcus's tone seemed to comfort her. She squeezed his hand tighter. "Thank you for saying that. Sometimes it helps to hear it from someone who sees what goes on here every day." Marcus stayed with her for a few more minutes, offering what comfort he could without revealing the extent of his knowledge about her son's condition. When Dr. Williams finally came out to speak with the family, Marcus quietly returned to his cleaning duties, but he felt the weight of the interaction. He had crossed another line, providing medical reassurance based on professional knowledge he wasn't supposed to possess. As his shift ended, Marcus realized that the night had changed something fundamental about his situation. He had been forced to make too many small revelations, to help in ways that revealed more of his true capabilities. The carefully constructed wall around his identity was developing cracks that might soon become impossible to hide. The following evening brought an unexpected visitor to Marcus's carefully ordered world. Thomas Brennan, the paramedic who had been injured in the accident, was now recovering in room 315. His surgery had been successful, but he would be in the hospital for several more days while his internal injuries healed. When Marcus arrived for his shift, he found Brennan awake and alert, his trained eyes following the night janitor's movements with obvious interest. Marcus tried to clean the room normally, but he could feel Brennan's scrutiny. The paramedic was studying him with the same intensity Marcus had seen in medical colleagues who were trying to solve a puzzle. After several minutes of careful observation, Brennan spoke. "You know, I've been thinking about our conversation last night," he said, his voice stronger than it had been during the crisis. "Something about the way you talked, the way you understood what was happening to me. It reminded me of conversations I've had with doctors and nurses, not maintenance staff." Marcus continued cleaning, trying to keep his expression neutral. "I've been working here for 3 years," he replied. "You pick up a lot just by being around medical professionals." Brennan wasn't satisfied with that answer. "Maybe," he said. "But I've worked with a lot of different people in emergency medicine. There's a difference between someone who's picked up knowledge casually and someone who's been trained. The way you assessed my condition, the way you knew I needed immediate attention, that wasn't casual observation." Marcus felt trapped between honesty and self-preservation. He finished cleaning and prepared to leave, but Brennan's next words stopped him at the door. "I won't say anything to anyone," Brennan said quietly. "I don't know what your story is, but I recognize someone who's been trained to save lives. If you need to keep that private, I understand. Sometimes life forces us into situations we never planned for." Marcus turned back to face the paramedic, seeing understanding rather than suspicion in his eyes. Brennan was offering him something rare, acceptance without questions. But Marcus wasn't ready to trust anyone with his secret, not even someone who seemed to understand. "Thank you," Marcus said simply. "I hope your recovery goes well." He left the room, but Brennan's words followed him throughout the night. For the first time in 3 years, someone had seen through his carefully constructed facade and offered acceptance rather than judgment. It was both terrifying and oddly comforting. The rest of the hospital was unusually quiet after the previous night's chaos. Marcus moved through his rounds with practiced efficiency, but his mind kept returning to Brennan's words. The paramedic had recognized something in him that Marcus had thought was completely hidden. If one person could see through his disguise, how many others might be noticing things he thought he had concealed? In the cardiac unit, Marcus encountered a situation that would test his resolve more than any before. Room 319 held a new patient, Maria Santos, a 43-year-old teacher who had been admitted with chest pain. Her teenage daughter Sophia sat beside her bed, trying to stay awake despite the late hour. The girl was clearly frightened, and Marcus could see the worry in her eyes as she watched her mother's monitors. Mrs. Santos was experiencing what appeared to be unstable angina, a condition that could rapidly progress to a full heart attack. Marcus could see the subtle signs in her vital signs, the way she was breathing, the slight changes in her color. She needed immediate cardiac catheterization, but the procedure wouldn't be available until morning unless her condition deteriorated significantly. As Marcus cleaned the room, he listened to Sophia trying to comfort her mother. The girl was doing her best to be strong, but Marcus could see the fear beneath her brave facade. She reminded him of Lily, and how frightened his daughter would be if she were in Sophia's position. "Is everything going to be okay?" Sophia asked her mother, her voice small and worried. Mrs. Santos squeezed her daughter's hand. "The doctors are taking good care of me," she said. "Try to get some rest." But Marcus could see that Mrs. Santos was more worried than she was letting on. Her cardiac symptoms were worsening, and she was fighting to hide her distress from her daughter. The situation was becoming critical, and Marcus knew that waiting until morning for intervention might be too late. Have you ever watched someone you love struggle with their health? Where in the world are you listening to Marcus's story right now? Whether you're at home, at work, or somewhere in between, you understand the helplessness that comes with watching someone suffer while feeling powerless to help. Marcus's struggle is about more than just his secret, it's about the fundamental human need to use our gifts to help others. Marcus finished cleaning and moved to the hallway, but positioned himself where he could observe Mrs. Santos's room. Within 20 minutes, he noticed changes in her monitors that confirmed his fears. Her condition was deteriorating rapidly, and she was trying to hide it from her daughter. The girl had finally fallen asleep in the chair, exhausted from hours of worry. Marcus faced an impossible choice. He could alert the nursing staff to check on Mrs. Santos, but explaining how he knew she was in distress would require revealing knowledge he shouldn't possess. On the other hand, if he waited for the medical staff to notice the changes on their own, Mrs. Santos might suffer irreversible heart damage. He made his decision quickly, approaching the nurse's station where Jennifer Rodriguez was managing the night shift. "Jennifer," he said quietly, "I was cleaning room 319, and Mrs. Santos seemed to be having some increased discomfort. She didn't want to wake her daughter, but she mentioned feeling short of breath." Jennifer looked up from her paperwork, immediately alert. "Thanks, Marcus. I'll check on her right away." Marcus returned to his cleaning duties, but watched as Jennifer quickly assessed Mrs. Santos and called for Dr. Williams. Within minutes, Mrs. Santos was being prepared for emergency cardiac catheterization. The procedure would save her life and prevent permanent damage to her heart. As the medical team worked, Marcus caught a glimpse of Sophia waking up to find her mother surrounded by doctors and nurses. The girl's face showed the same terror Marcus had seen in countless family members when their loved ones faced medical crises. But he knew that because of his intervention, Sophia wouldn't lose her mother tonight. Dr. Williams passed Marcus in the hallway as they wheeled Mrs. Santos to the cardiac catheterization lab. The procedure went smoothly, and Mrs. Santos would make a full recovery. But Marcus knew he had taken another step closer to exposure. His pattern of knowing when patients were in distress was becoming too consistent to ignore. Later, as he finished his rounds, Marcus reflected on the night's events. Brennan's recognition of his medical knowledge, his intervention with Mrs. Santos, the increasingly difficult balance between helping and hiding, all of it was building toward a moment when he would have to choose between his secret and his calling. The sun was rising as Marcus prepared to leave the hospital, but he couldn't shake the feeling that his carefully constructed invisible life was approaching a breaking point. Change was coming, whether he was ready for it or not. The pattern was becoming impossible to ignore. Over the next week, Marcus found himself intervening in subtle ways that were drawing attention from the medical staff. His quiet suggestions about patients who needed attention, his uncanny ability to notice when someone was in distress, and his perfect execution of basic medical procedures during the mandatory training sessions were creating a puzzle that some people were beginning to solve. Dr. Sarah Williams was one of those people. She had worked at Metro General for 8 years, and she had developed an instinct for reading people that served her well in medicine. Lately, she had been noticing the night janitor in ways that made her curious. Marcus Chen was different from other support staff she had worked with, and she couldn't quite pinpoint why. It started with small observations. The way he moved through the cardiac unit with unusual confidence, how he seemed to understand the rhythm of the hospital better than people who had worked there longer, and most intriguingly, how he always seemed to know when a patient was in trouble before the nursing staff noticed. Dr. Williams had begun keeping mental notes of these incidents, and the pattern was becoming clear. Tonight, she decided to pay closer attention to Marcus during his rounds. She positioned herself at the nurse's station where she could observe his interactions with patients and staff. What she saw confirmed her suspicions. Marcus wasn't just cleaning rooms, he was conducting informal assessments of every patient he encountered. His movements were systematic, professional, and far too knowledgeable for someone with his supposed background. In room 321, Marcus was cleaning around an elderly patient named Harold Morrison, who had been admitted for heart failure management. Dr. Williams watched as Marcus noticed something about the patient's condition that made him pause. Mr. Morrison's breathing had become more labored, and his legs were showing increased swelling, signs that his heart failure was worsening. Marcus finished his cleaning and approached the nurse's station, where he found Kevin Thompson catching up on patient charts. "Kevin," Marcus said quietly, "Mr. Morrison in 321 mentioned feeling more short of breath tonight. He seemed concerned about the swelling in his legs too." Kevin looked up from his paperwork, grateful for the information. "Thanks, Marcus. I'll check on him right away." Dr. Williams watched this interaction with growing certainty. Marcus's observation was medically accurate and clinically relevant. He had noticed signs of decompensating heart failure before the nursing staff had picked up on them. This wasn't casual observation, it was professional assessment disguised as custodial care. She decided to test her theory. When Marcus moved to the next room, Dr. Williams followed at a distance, observing his behavior with the scrutiny she usually reserved for medical students. In room 323, Marcus was working around a patient who had undergone cardiac catheterization earlier that day. Dr. Williams watched as Marcus's eyes moved to the insertion site on the patient's groin, checking for signs of bleeding or hematoma formation with the practiced eye of someone who had seen thousands of such procedures. The patient, Mrs. Chen, was awake and seemed uncomfortable. Marcus paused in his cleaning, his attention focused on her with obvious concern. "Mrs. Chen," he said gently, "how are you feeling? Any unusual pain or discomfort since your procedure?" Mrs. Chen shifted uncomfortably. "There's some pressure where they did the procedure," she said. "It feels different than earlier." Marcus moved closer, his professional instincts taking over despite his efforts to remain invisible. Without thinking, he glanced at the insertion site, noting the slight swelling and discoloration that indicated a developing hematoma. This was a potentially serious complication that needed immediate attention. "I think your nurse should take a look at that," Marcus said, his voice calm but urgent. Sometimes after these procedures, it's important to monitor the insertion site carefully. Dr. Williams stepped into the room at that moment, having heard the entire exchange. She moved directly to Mrs. Chen's bedside and examined the insertion site, immediately recognizing the signs of hematoma formation that Marcus had identified. Her assessment confirmed what Marcus had already diagnosed, a significant complication that required immediate intervention. As Dr. Williams worked to manage the situation, she was acutely aware of Marcus's presence in the room. He had positioned himself where he could observe her work, and she could see the professional interest in his eyes. This wasn't curiosity, it was the focused attention of someone who understood exactly what she was doing and why. After stabilizing Mrs. Chen and ensuring she was comfortable, Dr. Williams stepped into the hallway where Marcus was waiting with his cleaning cart. She studied his face for a moment, seeing something there that confirmed her growing suspicions. "Marcus," she said quietly, "can I ask you something? How did you know to look for hematoma formation at the insertion site?" Marcus felt his heart rate spike, but kept his expression neutral. "I've seen a lot of patients after cardiac procedures," he replied. "You learn to recognize when something doesn't look right." Dr. Williams nodded slowly, but her expression remained thoughtful. "Your observational skills are quite remarkable," she said. "In fact, they're better than some of the residents I work with. Have you ever considered a career in healthcare?" The question hit Marcus like a physical blow. For a moment, he almost told her the truth, almost revealed the career he had lost and the skills he was forced to hide. But the image of Lily sleeping safely at home kept him silent. "I'm content with my current position," he said finally. "I like being able to help in my own way." Dr. Williams studied him for another moment, then nodded. "Well, your help tonight may have saved Mrs. Chen from a serious complication. Thank you for being so observant." As she walked away, Marcus realized that his secret was no longer as secure as he had believed. Dr. Williams suspected something, and her medical training made her a dangerous observer. She was putting together pieces of a puzzle that could expose everything he had worked to hide. The rest of the night passed in a blur of anxiety and careful movement. Marcus completed his rounds with unusual caution, aware that he was being watched and evaluated by someone who understood the medical significance of his actions. Every decision, every observation, every interaction was now a potential revelation of his true identity. As dawn approached, Marcus reflected on how drastically his situation had changed. What had begun as a simple plan to remain invisible while staying close to medicine had become an increasingly complex web of partial truths and careful deceptions. The skills he had trained for years to develop were becoming impossible to suppress, and the people around him were beginning to notice. Walking home through the quiet streets, Marcus knew that his time as an invisible janitor was running out. Dr. Williams's suspicions, Brennan's recognition, Elena's growing curiosity, all of it was building toward a moment when he would have to choose between his daughter's safety and his calling as a physician. The question was no longer whether his secret would be discovered, but when, and what he would do when that moment arrived. The tension in Marcus's life reached a breaking point 3 nights later when the hospital faced its most challenging emergency since he had started working there. A kitchen fire at a local nursing home had resulted in multiple elderly patients being transported to Metro General with smoke inhalation and burn injuries. The emergency department was overwhelmed, and patients were being admitted to every available bed throughout the hospital. Marcus arrived for his shift to find the cardiac unit transformed into a makeshift emergency treatment area. Elderly patients filled the hallways on gurneys, their faces covered with oxygen masks, their frightened eyes searching for comfort in the chaos. The nursing staff was pushed beyond their limits, trying to manage twice their normal patient load while maintaining the critical care standards that cardiac patients required. Dr. Williams was everywhere at once, moving between patients with the focused intensity of someone managing a disaster. Marcus could see the strain on her face, the weight of responsibility for so many vulnerable lives. As he began his rounds, he realized that this night would test every boundary he had established for himself. In the hallway outside room 318, an 82-year-old woman named Dorothy Phillips lay on a gurney, waiting for a bed to become available. She had been at the nursing home when the fire started, and the smoke exposure had compromised her already fragile respiratory system. Her daughter knelt beside the gurney, holding her mother's hand while tears streamed down her face. Marcus approached them quietly, ostensibly to clean the area around the gurney. But his trained eye immediately assessed Mrs. Phillips's condition. Her oxygen saturation was dropping despite the mask, her breathing was becoming increasingly labored, and she was showing signs of acute respiratory distress. She needed immediate intervention, but the medical staff was stretched too thin to notice her deteriorating condition. Mrs. Phillips looked at Marcus with frightened eyes, her breathing shallow and rapid. She was trying to speak, but the oxygen mask made it difficult. Marcus leaned closer, lifting the mask slightly so he could hear her whispered words. "Can't breathe," she gasped. "Something's wrong." Marcus felt his professional instincts take over completely. Mrs. Phillips was in respiratory failure, and without immediate intervention, she would go into cardiac arrest. The medical staff was busy with other critical patients, and by the time they noticed her condition, it might be too late. He made a decision that would change everything. Moving quickly but calmly, Marcus approached the portable crash cart that had been positioned in the hallway for the emergency. He grabbed a bag valve mask and returned to Mrs. Phillips's side, his movements professional and confident. "What are you doing?" asked Mrs. Phillips's daughter, confusion and hope mixing in her voice. Marcus positioned the bag valve mask over Mrs. Phillips's face, checking the seal with practiced efficiency. "I'm going to help her breathe," he said simply. His technique was flawless, the rhythm perfect, his assessment of the patient's needs immediate and accurate. Dr. Williams appeared at his shoulder, having noticed the commotion. She stopped in her tracks when she saw Marcus providing advanced respiratory support with the skill of a trained medical professional. His hand position was perfect, his ventilation technique textbook quality, and his assessment of the patient's condition was exactly what she would have done herself. For a moment, she stood frozen, watching the night janitor perform a medical intervention that required years of training to execute properly. Then her medical instincts took over, and she moved to help, bringing additional equipment while Marcus continued the ventilation. "Good work," she said quietly, her voice filled with questions she couldn't ask in the middle of a crisis. "Keep that up while I get intubation supplies." Marcus nodded, continuing to provide respiratory support while Dr. Williams prepared for the more advanced procedure. They worked together seamlessly, their movements coordinated like a team that had been practicing together for years. Marcus anticipated her needs, positioning the patient correctly, maintaining ventilation while she prepared the intubation equipment. What part of Marcus's struggle resonates most with you? Have you ever felt torn between protecting someone you love and using your gifts to help others? Whether you're listening from your car, your home, or somewhere else entirely, you understand the weight of making choices that affect not just your own life, but the lives of those who depend on you. As Dr. Williams successfully intubated Mrs. Phillips, Marcus stepped back, returning to his role as the invisible janitor. But the moment had been witnessed by several staff members, and there was no hiding what they had seen. His technique had been too perfect, his knowledge too comprehensive, his instincts too professional. Elena Vasquez had watched the entire incident from across the hallway, her expression a mixture of understanding and concern. She approached Marcus as he attempted to return to his cleaning duties, her voice gentle but firm. "Marcus," she said quietly, "I've been working in hospitals for 15 years. I know the difference between someone who's learned first aid and someone who's been trained to save lives. What I just saw wasn't something you picked up from watching other people work." Marcus felt trapped, exposed in a way he had never experienced since arriving at Metro General. The carefully constructed walls around his identity had been shattered in a moment of crisis, and there was no way to rebuild them. "I did what anyone would do in that situation," he said, but even he knew how inadequate that sounded. Elena shook her head. "No, Marcus. What you did required years of medical training. The way you worked with Dr. Williams, the way you anticipated what she needed, that was professional-level emergency medicine." Before Marcus could respond, Dr. Williams approached them, her expression thoughtful and determined. She had questions that needed answers, and Marcus could see that she wouldn't be satisfied with vague explanations about picking up knowledge from observation. "Marcus," she said, "I need to speak with you privately. What happened tonight, what I saw you do, that level of skill doesn't come from casual observation. I need to know who you really are." Marcus looked around the hallway, seeing the other staff members watching him with new awareness. His secret was no longer secret, and the moment he had dreaded for 3 years had finally arrived. The choice between his hidden identity and his calling as a healer had been made for him by a crisis that demanded he use every skill he possessed. Mrs. Phillips was alive because of his intervention, but his carefully constructed invisible life was over. The question now was what would happen next, and whether he could find a way to protect his daughter while acknowledging the truth about who he really was. The night was far from over, but Marcus knew that when the sun rose, he would no longer be just the night janitor at Metro General Hospital. The secret that had defined his life for 3 years was about to be revealed, and there was no going back. Dr. Williams led Marcus to a small conference room away from the chaos of the emergency response. The room was quiet, a stark contrast to the controlled urgency that filled the rest of the hospital. Marcus sat across from her, his hands folded on the table, knowing that the conversation they were about to have would change everything. Sarah Williams had been practicing medicine long enough to recognize exceptional skill when she saw it. What she had witnessed in the hallway wasn't the work of someone who had picked up medical knowledge casually. Marcus's technique had been flawless, his assessment immediate and accurate, his coordination with her seamless and professional. "Marcus," she began, her voice gentle but firm, "I've been a doctor for 12 years. I've worked with residents, attending physicians, paramedics, and nurses. What I saw you do tonight was the work of someone with extensive medical training. I need you to tell me the truth about who you are." Marcus stared at his hands, feeling the weight of 3 years of carefully constructed deception pressing down on him. The moment he had dreaded and simultaneously longed for had finally arrived. Part of him was relieved that the pretense was over, but another part was terrified of what exposure might mean for his daughter. "I used to be a doctor," he said quietly, his voice barely above a whisper. "A long time ago, in what feels like another life." Dr. Williams leaned forward, her expression showing interest rather than judgment. "What kind of doctor?" she asked. "Cardiac surgeon," Marcus replied. "I specialized in complex cardiac procedures, trauma surgery, emergency cardiac intervention. I practiced at Johns Hopkins for 8 years." The admission hung in the air between them. Dr. Williams studied his face, seeing the pain and loss that he had carried for so long. She had suspected he had medical training, but a cardiac surgeon was far beyond what she had imagined. "What happened?" she asked gently. "How did you end up working as a janitor?" Marcus took a deep breath, preparing to reveal the story he had kept buried for 3 years. "There was a malpractice lawsuit," he said. "A patient died during surgery, and the family claimed I had made an error in judgment. The case went to court, and even though I was eventually exonerated, the media attention was devastating. Reporters followed me everywhere, camped outside my home, bothered my colleagues and my daughter." He paused, the memories still painful after all this time. "My daughter Lily was only 5 then. She couldn't understand why strangers were taking pictures of her, why other kids at school were asking her if her daddy was a bad doctor. The stress was destroying her childhood, and I realized I had to choose between my career and her well-being." Dr. Williams felt her heart go out to him. The medical profession could be unforgiving, and she knew how devastating a malpractice suit could be, even when the physician was ultimately vindicated. "You gave up your medical career to protect your daughter," she said. Marcus nodded. "I legally changed our last name, moved to a different city, and found work that would keep me close to medicine without exposing us to the kind of scrutiny that had made our lives unbearable. The night shift at Metro General let me stay connected to the medical world while keeping us invisible." Dr. Williams was quiet for a moment, processing the magnitude of what Marcus had sacrificed. She thought about her own career, how devastating it would be to lose the ability to practice medicine, to help patients, to use skills that had taken decades to develop. "Marcus," she said finally, "what you did tonight saved Mrs. Phillips's life. Your skills, your knowledge, your instincts, those are gifts that could benefit so many people. Have you ever thought about returning to medicine?" Marcus looked up at her, and she could see the longing in his eyes. "Every day," he said. "Every night when I walk through these halls, I think about the patients I could help, the procedures I could perform, the lives I could save. But I also think about my daughter, about the normal life she has now, about the price we would both pay if I stepped back into the spotlight." Dr. Williams understood his dilemma, but she also saw the waste of keeping someone with his abilities in the shadows. "Marcus," she said, "the medical field has changed since you left. There are ways to practice medicine that don't require the kind of public exposure that caused you problems before. Rural hospitals, night shift positions, emergency medicine roles that focus on patient care rather than public recognition." Marcus felt a flicker of hope, but it was tempered by 3 years of careful protection of his daughter's privacy. "It's not that simple," he said. "If I return to medicine, there will be background checks, licensing reviews, media attention when people discover that Dr. Marcus Chen is back. I can't risk putting Lily through that again." Dr. Williams leaned back in her chair, thinking about the complexity of his situation. She had seen the skill with which he had handled the emergency, and she knew that someone with his abilities could make an enormous difference in patient care. But she also understood his need to protect his daughter. What if there was a way to help patients without fully returning to your old life? She asked. What if you could use your skills in a capacity that provided some protection for your privacy? Marcus looked at her with curiosity. What do you mean? Dr. Williams was formulating an idea, thinking about the hospital's needs and Marcus's unique situation. We're always short-staffed on nights, especially in the cardiac unit. What if there was a way for you to assist with patient care in a more official capacity, but without the full exposure that comes with being an attending physician? The idea was intriguing, but Marcus remained cautious. Any official role would require disclosure of his medical background, and that disclosure could lead to the kind of attention he had worked so hard to avoid. I need to think about this, he said. My daughter's safety and privacy have to be my first priority. Dr. Williams nodded, understanding his caution. Of course, she said. But Marcus, what I saw tonight was extraordinary. You have skills that could save lives, and I think there might be a way to use those skills without compromising your daughter's well-being. As they prepared to leave the conference room, Dr. Williams made one final observation. You know, she said, Lily is older now. She's 8, not 5. Children are often more resilient than we think, and she might be able to handle more than you realize. Marcus considered her words as they returned to the cardiac unit. The emergency was winding down, and the nursing home patients were being settled into their temporary accommodations. Mrs. Phillips was stable in the ICU, alive because of his intervention, and Marcus felt the familiar satisfaction that came from saving a life. But he also felt the weight of exposure, the knowledge that his carefully constructed invisible life was no longer sustainable. Too many people knew his secret now, and the question was no longer whether he would have to make a choice about his future, but what that choice would be. As his shift ended, Marcus walked home through the quiet streets, his mind churning with possibilities and fears. Dr. Williams had offered him something he had thought was impossible, a way back into medicine that might not require sacrificing his daughter's safety. But after 3 years of hiding, the prospect of stepping back into the light was both exhilarating and terrifying. The sun was rising as he climbed the stairs to their apartment, where Lily would soon be waking up for school. She was the reason for every choice he had made, every sacrifice he had endured. Now he had to decide whether protecting her meant continuing to hide his gifts, or whether it meant finding the courage to use them again. Marcus spent the entire day wrestling with Dr. Williams's words. As he prepared breakfast for Lily, helped her with her backpack, and walked her to school, his mind kept returning to the conversation in the conference room. The possibility of returning to medicine, even in a limited capacity, felt like a door opening after 3 years of being locked away from his true calling. But doubt crept in as he watched Lily laugh with her friends at the school playground. She was happy, secure, living the normal childhood he had sacrificed everything to give her. She had friends who didn't know about her father's past, teachers who saw her as just another bright student, and a life free from the scrutiny that had once made simple activities like going to the park feel dangerous. That evening, as Marcus prepared for his shift at Metro General, he made a decision that surprised even him. Instead of avoiding the conversation with Dr. Williams, he would seek her out. He needed to understand exactly what she was proposing, what the risks might be, and whether there was truly a way to use his medical skills without destroying the life he had built for his daughter. He arrived at the hospital to find Dr. Williams waiting for him at the nurse's station. She had clearly been thinking about their conversation as much as he had, and her expression showed both determination and understanding. Marcus, she said, I've been researching your case. The malpractice suit was overturned on appeal, and the medical board cleared you of any wrongdoing. Your surgical record was exemplary, and the patient's death was due to complications that were beyond anyone's control. Marcus felt a familiar pain at the mention of his old life. The legal vindication had come too late to save his career or his reputation. The media had moved on to other stories, but the damage to his professional standing had been permanent. Dr. Williams continued, "I've also been thinking about what you said regarding your daughter. What if she could be part of the solution instead of the reason you have to hide?" Marcus looked at her with confusion. "What do you mean?" She pulled out a folder from her desk. "I've been looking into rural hospital positions, emergency medicine roles that focus on patient care rather than public recognition. There are opportunities in smaller communities where you could practice medicine without the kind of media attention that caused you problems before." Marcus felt his heart rate increase. The idea of practicing medicine again, of using his skills to save lives, was almost too appealing to consider seriously. But the practical concerns remained overwhelming. "Even if I could find a position like that," he said, "there would still be background checks, licensing reviews, questions about why I disappeared from medicine for 3 years. And what about Lily? She's settled here, she has friends, she's happy in school." Dr. Williams leaned forward. "Marcus, your daughter is 8 years old. She's old enough to understand that her father is a doctor, that he helps people, that he had to stop working as a doctor for a while but now he can go back to helping people. Children often adapt better than we think they will." Marcus thought about Lily's questions over the years. She had asked why he worked at night, why he knew so much about medicine, why he seemed sad sometimes when he talked about his work. He had always deflected these questions, but perhaps she was ready for more truth than he had been willing to share. Dr. Williams opened the folder and showed him several job postings. "Look at this," she said. "Rural emergency medicine positions, night shift cardiology roles, positions that value skill and experience over publicity. You could save lives again, Marcus. You could use the gifts you've been hiding." Marcus studied the job descriptions, feeling a longing he had suppressed for 3 years. These were positions where he could practice medicine, where his skills would be valued, where he could make a difference in people's lives. But the fear of exposure, of returning to the spotlight that had nearly destroyed his daughter's childhood, remained powerful. "There's something else," Dr. Williams said. "I've spoken with the hospital administration about creating a position here. A night shift cardiac consultation role that would allow you to assist with complex cases without the full responsibility of being an attending physician. It would give you a chance to use your skills while maintaining some privacy." Marcus felt his carefully constructed walls beginning to crumble. The opportunity she was describing was exactly what he had dreamed of during his long nights of cleaning floors and emptying trash cans. A chance to practice medicine again, to save lives, to use the skills he had trained for decades to develop. "But what about the background checks?" he asked. "What about the questions that would come when people realize that Dr. Marcus Chen is back?" Dr. Williams had clearly thought about this. The hospital administration is more concerned with patient care than with past legal issues, especially when those issues were resolved in your favor. And the position I'm describing would be largely behind the scenes, working with patients and medical staff rather than dealing with media or public relations. Marcus felt himself wavering. The possibility of returning to medicine, of using his skills to help patients, was almost overwhelming. But the image of Lily's trusting face kept him grounded in the reality of his responsibilities as a father. "I need to talk to my daughter," he said finally. "This decision affects her as much as it affects me. I need to know how she feels about the possibility of people knowing that her father is a doctor." Dr. Williams nodded. "That's exactly what I was hoping you would say. She's the most important person in your life, and she deserves to be part of this decision." As Marcus began his rounds that night, his mind was filled with possibilities he had thought were closed to him forever. The patients he encountered, the medical situations he observed, the skills he had been forced to suppress, all of it took on new meaning in light of Dr. Williams's offer. In room 315, Thomas Brennan was recovering well from his surgery. When Marcus entered to clean the room, the paramedic looked at him with knowing eyes. "I heard there was some excitement last night," Brennan said. "Something about the night janitor performing some pretty impressive emergency medicine." Marcus realized that news of his intervention with Mrs. Phillips had spread through the hospital. His secret was no longer secret, and the carefully constructed invisible life he had built was already changing. I did what anyone would do, Marcus said, but he could see that Brennan wasn't buying the modest deflection. Anyone with advanced medical training, maybe, Brennan replied. Look, I don't know what your story is, but I know skill when I see it. If you're thinking about stepping back into medicine, you should know that people like you are exactly what the medical field needs. Marcus finished cleaning the room, but Brennan's words stayed with him. For 3 years, he had told himself that his sacrifice was necessary, that hiding his skills was the price of protecting his daughter. But now, multiple people were telling him that his skills were needed, that there might be a way to use them without destroying the life he had built. As his shift ended, Marcus realized that he was standing at a crossroads. He could continue as he had been, hiding his abilities and protecting his daughter through invisibility. Or he could take the risk of stepping back into the light, of trusting that the life he had built was strong enough to withstand the challenges that might come. The decision would ultimately be his daughter's as much as his own. But for the first time in 3 years, Marcus allowed himself to hope that there might be a way to be both the father Lily needed and the doctor he had always been meant to be. Marcus spent the next morning preparing for the most important conversation of his life. As he made pancakes for Lily, watched her pack her school bag, and walked her to the playground, he rehearsed different ways to explain the situation. How do you tell an 80-year-old that her father used to be a doctor, that he gave up medicine to protect her, and that now he was considering returning to the career he had abandoned? After school, Marcus suggested they go to their favorite spot in the park, a quiet bench overlooking the duck pond where they often had their most serious conversations. Lily sensed something important was coming and sat beside him with the patient attention she always gave when her father had something significant to say. Lily, Marcus began, I need to tell you something about my work, about who I used to be before we moved here. Lily looked up at him with curious eyes. You mean before you worked at the hospital cleaning? Marcus nodded. Before I worked cleaning at the hospital, I was a doctor. A special kind of doctor who helped people with heart problems. Lily's eyes widened with interest rather than surprise. I knew it, she said. You always know things about medicine that other people don't know. And you get sad sometimes when you talk about your work, like you miss doing something else. Marcus felt a wave of love and pride for his daughter's perceptiveness. She had understood more than he had realized. You're right, he said. I do miss being a doctor. I loved helping people, saving lives, making sick people better. Why did you stop being a doctor? Lily asked. Marcus took a deep breath. Someone blamed me for something that wasn't my fault, and it caused a lot of problems. Reporters and photographers started following us everywhere, asking questions, taking pictures. Do you remember when we lived in Baltimore, how sometimes people would follow us and ask questions? Lily nodded. I remember being scared sometimes. And you were always worried about people watching us. Marcus felt his heart ache at the memory of her fear. That's why we moved here, why I became Marcus Chen instead of Dr. Chen. I wanted you to have a normal childhood, to go to school without people asking questions about your daddy. Lily was quiet for a moment, processing this information. Then she asked the question that would determine their future. Do you want to be a doctor again? Marcus looked at his daughter, seeing the intelligence and maturity that had grown in her over the past 3 years. More than anything, he said honestly. But only if it wouldn't make you scared or unhappy. Lily considered this carefully. Would you still be my daddy if you were a doctor again? Marcus pulled her closer. Always, he said. Being your daddy is the most important job I'll ever have. And would you still help people get better? Lily asked. Yes, Marcus said. I would help people who are sick, especially people with heart problems. Lily smiled up at him. Then I think you should be a doctor again. You're really good at helping people, and it makes you happy when you can help them. Marcus felt tears in his eyes. You're not worried about people asking questions or taking pictures? Lily shook her head. I'm 8 now, not 5. I'm not scared of people asking questions about my daddy helping sick people. I'm proud that you're a doctor. That evening, Marcus called Dr. Williams to tell her about his conversation with Lily. Her response was immediate and supportive. "That's wonderful, Marcus. I think you'll find that children are often more resilient than we expect. When can you come in to discuss the position we talked about?" Marcus felt a mixture of excitement and nervousness. "Tomorrow night," he said. "But Dr. Williams, I want to be clear that my daughter's well-being comes first. If returning to medicine causes problems for her, I'll step back immediately." Dr. Williams understood. "Of course," she said. "But Marcus, I think you're going to find that being true to yourself as a physician might be the best thing you can do for your daughter." The next night, Marcus arrived at Metro General with a different perspective. Instead of hiding his medical knowledge, he found himself paying attention to patient care in a new way. He wasn't just observing anymore, he was preparing to be involved again. In the cardiac unit, he encountered a situation that tested his resolve. Room 320 held a 55-year-old man named Robert Taylor who was experiencing complications after bypass surgery. Mr. Taylor was in distress, his vital signs showing patterns that Marcus recognized as signs of cardiac tamponade, a life-threatening condition where fluid builds up around the heart. The nursing staff was busy with other patients, and Marcus could see that Mr. Taylor's condition was deteriorating rapidly. This was the kind of emergency that required immediate recognition and intervention. In his previous life, Marcus would have been the surgeon called to handle this exact situation. Marcus made a decision that marked the beginning of his return to medicine. Instead of finding a subtle way to alert the nursing staff, he walked directly to the nurse's station and spoke to Jennifer Rodriguez with the authority of someone who understood the medical emergency unfolding. "Jennifer," he said, "Mr. Taylor in room 320 is showing signs of cardiac tamponade. His jugular veins are distended, his blood pressure is dropping, and his heart sounds are muffled. He needs immediate attention." Jennifer looked at him with surprise, but she could see the urgency in his expression and the confidence in his assessment. She immediately called for Dr. Williams, who arrived within minutes to find Marcus's diagnosis completely accurate. Dr. Williams worked quickly to address the emergency, but she was acutely aware of Marcus's presence and his obvious understanding of the situation. After stabilizing Mr. Taylor, she approached Marcus with a question that would change everything. "Marcus," she said, "that was a perfect clinical assessment of cardiac tamponade. That's not something you learn from casual observation. Are you ready to stop pretending to be just the janitor?" Marcus looked around the cardiac unit, seeing the patients who needed care, the staff who needed support, and the opportunities to use his skills for the purpose he had trained for decades to serve. "Yes," he said simply. "I'm ready to be a doctor again." Dr. Williams smiled. "Then let's talk about how to make that happen. But first, let's go save Mr. Taylor's life properly." As they walked toward the cardiac catheterization lab, Marcus felt the weight of 3 years of hiding lift from his shoulders. He was still a father first, still protective of his daughter's well-being, but he was also ready to be the physician he had always been meant to be. The transformation had begun, and there was no going back. But for the first time in 3 years, Marcus didn't want to go back. He wanted to move forward, into a future where he could be both the father Lily needed and the doctor his patients deserved. The call came at exactly 2:47 a.m. on a Tuesday morning that would change everything. Marcus was in the middle of his conversation with Dr. Williams about returning to medicine when the hospital's emergency alert system activated. A massive industrial accident at the nearby chemical plant had resulted in multiple casualties, including several workers with severe cardiac injuries from electrical shock and chemical exposure. "All hands on deck," Dr. Williams said, her expression shifting to the focused intensity Marcus remembered from his own days managing trauma cases. "We're going to need every qualified person we can get." Marcus felt his pulse quicken. The moment he had been preparing for, the test of whether he could truly step back into medicine, was arriving sooner than expected. This wasn't going to be a gradual transition back to patient care. This was going to be a baptism by fire. The first ambulance arrived within minutes, bringing a 42-year-old plant supervisor named Michael Rodriguez who had been closest to the electrical explosion. His heart rhythm was chaotic, showing the dangerous arrhythmias that Marcus had seen in electrical injury cases during his residency. The man was conscious but in severe distress, his cardiac system struggling to maintain normal function. Dr. Williams was handling 2 other critical patients simultaneously, and the emergency department was overwhelmed with incoming casualties. Marcus watched as the nurses struggled to stabilize Mr. Rodriguez, their efforts hampered by the complexity of electrical cardiac injuries that required specialized knowledge. Marcus made the decision that would define his return to medicine. He stepped forward, no longer hiding behind the role of night janitor, and approached the patient with the confidence of someone who had handled hundreds of similar cases. "I need to help," he said to the attending nurse. "This patient has electrical injury to his cardiac conduction system. He needs immediate cardioversion and specialized arrhythmia management." The nurse looked at him with confusion and surprise. "Marcus, you're not authorized to treat patients." Dr. Williams appeared at his shoulder, having heard the exchange. She looked at Marcus, then at the patient's deteriorating condition, and made a decision that would save a life. "Marcus Chen is a cardiac surgeon," she announced to the team. "He's fully qualified to manage this case. Everyone follow his lead." The transformation was immediate and complete. Marcus shed the last vestiges of his janitor identity and became the physician he had always been. His hands moved with practiced precision as he assessed Mr. Rodriguez's condition, his voice clear and authoritative as he directed the medical team. "I need lidocaine for the ventricular arrhythmias," he said, his assessment rapid and accurate. "Prepare for synchronized cardioversion at 100 joules. And get me a 12-lead EKG to assess the extent of the conduction damage." The nurses responded to his commands with the efficiency of a well-trained team. Marcus's competence was immediately obvious, his knowledge comprehensive, his technique flawless. Within minutes, Mr. Rodriguez's heart rhythm was stable, his condition dramatically improved under Marcus's expert care. But the night was far from over. The second ambulance brought in a 28-year-old woman named Sarah Chen, no relation despite the shared surname, who had suffered both chemical burns and cardiac arrest at the scene. She had been resuscitated by paramedics, but her heart had stopped beating for nearly 6 minutes, and her condition was critical. Marcus took one look at her and knew they were facing a case that would test every skill he had ever learned. The combination of chemical exposure and prolonged cardiac arrest had created a complex medical emergency that required immediate and precise intervention. "This is going to require emergency cardiac catheterization," he said, his voice calm despite the urgency of the situation. "She's got massive coronary spasm from the chemical exposure, and the prolonged arrest has caused significant myocardial damage." Dr. Williams nodded, recognizing the accuracy of his assessment. "The cardiac catheterization lab is ready. Can you handle the procedure?" Marcus felt the familiar rush of adrenaline that came with life-or-death surgical decisions. "Yes," he said. "I've done this procedure hundreds of times." What followed was a display of surgical skill that reminded everyone in the room why Marcus had once been considered one of the most promising cardiac surgeons on the East Coast. His hands moved with precision and confidence as he navigated the cardiac catheterization, his knowledge of anatomy and technique evident in every movement. The procedure was complicated by the chemical damage to Sarah's coronary arteries, but Marcus adapted his technique seamlessly, using skills he had developed over years of handling complex cardiac cases. He worked with the focused intensity of someone who understood that a human life depended on his expertise. 45 minutes later, Sarah's coronary arteries were cleared, her heart rhythm was stable, and her prognosis had improved dramatically. The cardiac catheterization lab erupted in quiet applause as Marcus completed the procedure with the same precision he had once brought to operating rooms at Johns Hopkins. Dr. Williams approached him as he cleaned up after the procedure. "That was extraordinary," she said. "I've never seen someone handle a case that complex with such skill and calm." Marcus felt the satisfaction that came from using his gifts to save lives, the fulfillment he had missed for 3 years. "Thank you," he said. "It feels good to be practicing medicine again." As the night progressed, Marcus handled 3 more cardiac emergency cases, each one demonstrating his exceptional skill and knowledge. The hospital staff watched in amazement as the man they had known as a janitor revealed himself to be one of the most skilled cardiac surgeons they had ever seen. Thomas Brennan, the paramedic who had suspected Marcus's medical background, approached him during a brief break between cases. "I knew there was something special about you," he said. "But I had no idea you were this good." Marcus smiled, feeling more like himself than he had in years. "Sometimes we have to hide our gifts to protect the people we love. But tonight, I remembered why I became a doctor in the first place." Elena Vasquez, who had watched Marcus's transformation throughout the night, came over with tears in her eyes. "I've never seen anything like what you did tonight," she said. "You saved so many lives." As dawn approached, the last of the casualties from the industrial accident had been treated and stabilized. The crisis was over, but Marcus's return to medicine was complete. He had proven to himself and to everyone around him that his skills were intact, that his calling as a physician was as strong as ever. Dr. Williams found him in the break room, still wearing surgical scrubs instead of his janitor's uniform. "So," she said, "are you ready to make this official?" Marcus thought about his daughter, sleeping peacefully at home, proud of her father's return to medicine. He thought about the patients he had saved, the lives he had touched, the purpose he had rediscovered. "Yes," he said. "I'm ready to be Dr. Marcus Chen again." 6 months later, Dr. Marcus Chen stood in the cardiac catheterization lab at Metro General Hospital, preparing for his afternoon surgery schedule. The transformation from night janitor to respected cardiac surgeon had been remarkable, but the journey had been about more than just returning to medicine. It had been about learning to integrate all the parts of his identity into a life that honored both his calling as a physician and his role as a devoted father. The hospital administration had been incredibly supportive of his transition. Once they learned about his background and witnessed his exceptional skills during the industrial accident emergency, they had fast-tracked his credentialing process. Within 3 months, Marcus had been officially reinstated as a cardiac surgeon, with a position that allowed him to maintain the work-life balance he needed to be present for his daughter. His new schedule was perfect for both his professional and personal needs. He worked 3 12-hour shifts per week, primarily during evening and night hours when his expertise was most needed. This allowed him to be available for Lily's school events, help with homework, and maintain the close relationship they had built during their years of hiding. Lily had adapted to her father's return to medicine with the resilience he had always admired in her. She was proud to tell her friends that her daddy was a doctor who helped people with heart problems. When her 3rd grade class had career day, she had invited Marcus to speak about being a cardiac surgeon, and he had watched with pride as she introduced him to her classmates. The other children had been fascinated by his stories about helping people's hearts work better, and Marcus had realized that his daughter's confidence in his profession had helped other kids understand that doctors were heroes, not people to fear. The experience had been healing for both of them, marking the end of the shame and secrecy that had defined their lives for so long. Dr. Williams had become not just a colleague but a close friend. She had been instrumental in helping Marcus navigate his return to medicine, and her support had made the transition smoother than he had dared to hope. They often worked together on complex cases, and Marcus found that his skills had not only returned but had been enhanced by his years of careful observation and his deeper understanding of patient care. The nursing staff, many of whom had known him as the dedicated night janitor, had embraced his transformation with warmth and respect. Elena Vasquez often joked that she had known there was something special about him from the beginning, and she had become one of his strongest supporters in the cardiac unit. Thomas Brennan, the paramedic who had first suspected Marcus's medical background, had become a regular visitor to the hospital. He often sought Marcus's input on cardiac cases he encountered in the field, and their professional relationship had evolved into a friendship based on mutual respect and shared commitment to patient care. The patients Marcus treated were unaware of his unusual journey from surgeon to janitor to surgeon again. They only knew that Dr. Chen was exceptionally skilled, unusually compassionate, and deeply committed to their care. His bedside manner had been enhanced by his years of watching patients from a different perspective, and he brought a unique understanding of what it meant to feel invisible in a medical system. Marcus's reputation as a cardiac surgeon had been rebuilt on a foundation of demonstrated excellence rather than publicity or media attention. His colleagues respected him for his skills, his patients trusted him for his compassion, and his daughter loved him for being both a dedicated father and a physician who helped people. The malpractice case that had derailed his career years earlier had been completely resolved, and Marcus had learned that the patient's family had eventually acknowledged that his care had been exemplary. The media attention that had once seemed so destructive had faded into irrelevance, replaced by the quiet satisfaction of daily patient care and positive outcomes. On quiet evenings, Marcus would sometimes walk through the cardiac unit where he had once worked as a janitor, remembering the patients he had watched from a distance, the medical situations he had observed but couldn't influence, and the weight of hiding his true capabilities. Those memories served as a reminder of how precious it was to be able to use his gifts openly and fully. His relationship with his daughter had deepened through the process of his return to medicine. Lily had learned that her father's sacrifices had been made out of love for her, and she had come to understand that being true to yourself was sometimes the greatest gift you could give to the people you loved. She was proud of her father's work and secure in the knowledge that his success as a physician would never diminish his commitment to being her dad. If this story has touched your heart, know that you're part of a global community of people who believe in second chances and the power of using our gifts to help others. Whether you're listening from New York or New Delhi, London or Los Angeles, your support means everything to us. Please subscribe for more inspiring stories about ordinary people who discover extraordinary purpose in their lives. The story of Marcus Chen had become a quiet legend at Metro General Hospital, told to new employees as an example of how dedication, skill, and compassion could triumph over adversity. But for Marcus himself, the most important part of his story was yet to be written in the daily moments of patient care, fatherhood, and the integration of purpose and love. As he prepared for his next surgery, Marcus reflected on the journey that had brought him to this moment. He had learned that hiding from your calling might protect you temporarily, but embracing your gifts, even when it requires courage and risk, ultimately serves everyone better. His patients benefited from his skills, his daughter benefited from his authenticity, and he had rediscovered the joy that came from living a life aligned with his deepest values. The patient waiting for surgery was a 60-year-old grandmother who reminded Marcus of Mrs. Phillips, the woman whose life he had saved during the nursing home fire emergency. As he reviewed her case, Marcus felt the familiar mixture of responsibility and privilege that came with holding someone's life in his hands. He scrubbed in for surgery with the same meticulous care he had once brought to cleaning hospital rooms, understanding that excellence in any role required complete dedication to the task at hand. But now, instead of hiding his knowledge and skills, he was using them fully, openly, and with the support of colleagues who valued his contributions. The surgery was successful, and as Marcus completed the procedure, he thought about the gift of being able to save lives, the privilege of using his training to make a difference, and the joy of coming home to share his day with a daughter who was proud of both his profession and his devotion to her. Dr. Marcus Chen had found his way back to himself, and in doing so, had discovered that the best life was one where all parts of your identity could coexist in harmony. He was a cardiac surgeon and a devoted father, a skilled physician and a man who understood the value of service in any form. His story was proof that sometimes the longest journey home is the one that leads you back to who you were always meant to be.